Physical examinations start with inspection. Inspection literally means you're visually looking at the body, including their body movement, their posture. Smell is also part of the inspection. When you are using the technique of inspection, it will be like you're observing the shape of their chest, paying attention to their breathing, noting their rate, depth, and efforts of their respirations, noticing the overall color of their skin, lips, nail beds. At times, you might have to use the pen light to make sure that you are seeing everything clearly, especially into the mouth if you're looking for a skin lesion. Auscultation involves listening to sounds within the body. A stethoscope is usually used to facilitate auscultation. Stethoscope must be placed directly onto the skin because clothing, that could be patient's gown, it will alter the sound. Make sure you're warming up the head of the stethoscope before placing it on the patient. The friction of body hair rubbing against the diaphragm of the stethoscope, that could be mistaken for abnormal lung sounds like crackles. Diaphragm or bell of the stethoscope, whichever side you're using in your practice, it must be cleaned between patients to prevent the spread of infection. Palpation involves using the hands to feel texture, size, shape, consistency, pulsation, and location of certain parts of the patient's body. So it's tactile. You will be using hands. You will be touching the patient. You want to make sure like you are asking permission because you are into patient's personal space there. Also tell them what's the purpose of you touching them and where you will be touching them. The palmar surfaces of the fingers and finger pads are more sensitive to palpation than the fingertips. And if you're checking the temperature of their skin, you might want to use back of your hands because that is more sensitive to temperature. In this course, we will be using light palpation. Light palpation is accomplished by pressing down to a depth of approximately 1 centimeter and is used to assess skin, pulsations, and tenderness. You can use a bimanual palpation technique. So if you look into this video, I'm putting my hand over my right hand on the left hand when I'm doing the palpation of the abdomen there. You also want to keep in mind when you are using inspection, auscultation, and palpation that the sequence should be such that you're looking and then hearing and then touching them to feel anything. That should be the sequence because if you do not do that, if you palpate first, for example, you might move things around and it might change the results of your auscultation later on, especially for your GI assessment system.